Hello, Mrs. Jarvis. Today, we'll be talking about preventing kitchen accidents and how to respond to them if they do occur. First, let's talk about how to prevent cuts. Here are some tips to keep in mind. Use the right tools. Always use the right tools for the job, and make sure they are sharp and in good condition. Dull knives are more likely to slip and cause accidents. Pay attention. When using sharp objects, pay close attention to what you're doing. Avoid distractions like phones, TV, or conversations with others. Use cutting boards. Always use a cutting board when cutting food, and make sure it's stable and won't slip. Cut away from your body. When using a knife, always cut away from your body, and keep your fingers curled inwards. Store sharp objects safely. When not in use, store knives and other sharp objects in a safe place, away from children and pets. Now, let's talk about what to do if you do get a cut in the kitchen. Here's a step-by-step guide to follow. Stop the bleeding. Apply pressure to the wound with a clean cloth or bandage. If the bleeding is severe, elevate the injured area above the heart to slow down the bleeding. Clean the wound. Rinse the wound under cool running water to remove dirt and debris. If needed, use soap to clean the area around the cut. Cover the wound. Once the wound is clean and dry, cover it with a sterile bandage or adhesive strip to protect it from infection. Watch for signs of infection. Check the wound regularly to make sure it's healing properly. If you notice signs of infection, such as redness, swelling, or pus, seek medical attention. In short, preventing cuts in the kitchen is all about using the right tools, paying attention, and being mindful of safety. And if a cut does occur, remember to stop the bleeding, clean the wound, cover it up, and keep an eye on it for signs of infection. Secondly, we'll be discussing how to avoid slips and falls in the kitchen and what to do if you or someone else is injured as a result. Slips and falls are a common cause of injuries in the kitchen, but there are steps you can take to prevent them. Here are some tips to keep in mind. Keep floors clean and dry. Wipe up spills and splatters as soon as they happen, and use mats or rugs in areas that tend to get wet. Wear slip-resistant shoes. Shoes with good traction can help prevent slips and falls. Avoid wearing socks or slippers on slippery floors. Keep paths clear. Make sure there is enough space to move around the kitchen easily, and don't leave objects lying on the floor that can be tripped over. Use a step stool. When reaching for items on high shelves or cabinets, use a step stool instead of standing on chairs or counters. Now, let's talk about what to do if a slip or fall does occur in the kitchen. Here's a step-by-step guide to follow. Assess the situation. Determine if the person is conscious and breathing, and if there is any bleeding or visible injuries. Call for help. If the person is unconscious, not breathing, or has a serious injury, call 911 or your local emergency number immediately. Help the person to a safe place. If the person is conscious and able to move, help them to a safe place where they can sit or lie down. Treat injuries. If the person has a visible injury, such as a cut or scrape, clean the wound and apply a sterile bandage or dressing. Watch for signs of concussion. If the person hit their head during the fall, watch for signs of concussion, such as headache, dizziness, or confusion. Seek medical attention if these symptoms occur.
Thirdly, we'll be discussing how to avoid burns in the kitchen and what to do if you or someone else is injured as a result. Burns are a common cause of injuries in the kitchen, but there are steps you can take to prevent them. Here are some tips to keep in mind. 1. Never leave cooking food unattended on the stove, and turn pot handles away from the stove's edge. 2. Keep hot liquids and food away from the edge of tables and counters. 3. Use caution with hot appliances like curling irons and irons. 4. Keep matches and lighters out of reach of children. 5. Set your water heater's thermostat to 120 degrees Fahrenheit or lower. 6. Teach children to stay away from fire, hot surfaces, and liquids. First aid response for burns will require you to 1. Cool the burn with cool water for at least 20 minutes. Do not use ice, which can make the burn worse. 2. Cover the burn with a clean, dry, non-adhesive dressing. 3. Take an over-the-counter pain reliever such as ibuprofen or acetaminophen if needed. 4. If the burn is severe or covers a large area, call emergency services or go to the nearest emergency room immediately. 5. Do not break blisters or apply ointments or butter to the burn. 6. Monitor the person for signs of shock, which can include fainting, pale skin, and rapid heartbeat. Fourthly, we'll be discussing how to avoid fires in the kitchen and what to do if you or someone else is injured as a result. Fires are a common cause of injuries in the kitchen, but there are steps you can take to prevent them. Here are some tips to keep in mind. 1. Never leave cooking food unattended on the stove. 2. Keep flammable items like oven mitts, dish towels, and paper towels away from the stove. 3. Keep a fire extinguisher in your kitchen and learn how to use it. 4. Clean the stovetop and oven regularly to prevent the buildup of grease and food debris. 5. Check appliances for frayed cords, loose plugs, or other signs of wear and tear, and replace or repair as needed. 6. Avoid wearing loose clothing or long sleeves while cooking, as they can easily catch on fire. First aid response for kitchen fires will require the following. 1. If a small fire starts in a pan, immediately turn off the stove and cover the pan with a lid to smother the flames. 2. If a fire starts in the oven, turn off the heat and keep the door closed to starve the fire of oxygen. 3. If the fire is too large to control, evacuate the kitchen and call emergency services immediately. 4. In case of a burn injury, follow the first aid response for burns. Cool the burn with cool water for at least 20 minutes. Cover the burn with a clean, dry, non-adhesive dressing, etc. as mentioned in the previous question. 5. If someone's clothing catches on fire, tell them to stop, drop, and roll on the ground until the flames are out. Then, cool any burn injuries with cool water for at least 20 minutes and cover the burns with a clean, dry, non-adhesive dressing. Seek medical attention immediately if the burns are severe. Thank you for listening, and stay safe in the kitchen.